Decoration budget of around 10.8 billion Namibian dollars allocated by the Ministry of Finance through Ipumbu Shimi at the 2024-2025 budget speech. The question is, can this budget adequately close the gaps in the public health system and address the challenges of access to health and infrastructure development? In other words, can it effectively arrest what some lawmakers see as a national health crisis? Well, to help me unpack that, we are joined by Junior Shilunga, who is from the Namibia Nurses Union, as well as Emma Muteka. She's a deputy chairperson in the Committee of Health and Social Welfare and Labour Affairs in Parliament. A very good afternoon to you, Honourable Muteka.
A very good afternoon to you too, and good afternoon to the listeners.
Thank you so much for making some time for us this morning, Mr. Shilunga. To you, a very good afternoon and welcome back to the platform. Indeed. Thank you so much for making some time for us this particular afternoon. And perhaps I'll start with you, Mr. Shilunga. The Health Ministry has seen an expanded budget of approximately 10 billion Namibian dollars. Do you see this increase as adequate to close the gaps and holes you uncovered in the regions, or when you saw these problems being uncovered in the regions by the likes of Honourable Muteka and the others when they visited the regions with their committees last year? Is this budget enough?
Yeah, thank you very much. Allow us to contribute to the budgetary allocation for the Ministry of Health. So the budget of 10 billion, 10.7?
10.8.
10.8 billion. If we look in the history of this country and also the progress that we have made regarding the health sector, I am really not impressed by the budget. The first reason why is that Namibia is one of the AU countries that set in 2001 in Abuja, which is Nigeria, and they made a declaration to say, due to the crisis that Africa is facing, the health crisis that we are facing, they made a declaration that each AU state must allocate 15% of its budget to the Ministry of Health. And they call that declaration as Abuja Decoration. So looking at the budget, the total budget, which is 100 billion, and the 10 billion that is allocated to the Ministry of Health, you can already tell that these guys are not serious.
It's close enough, isn't it, to 15%?
But
it's not that far off.
They did not even reach the threshold of 15%.
But it's not that far off.
So it's to say, and also looking at what we have seen last year from the parliamentary committee, what they have uncovered, the crisis that we have seen in the regions, I have some reservation if this budget is going to do something.
Okay. Well, we'll dive deeper into that. I want to bring Honourable Muteka on the platform this particular afternoon. Honourable Muteka, you were on the ground last year. You uncovered some of these truths that we did see in the regions last year. This particular budget, does it reflect the urgency on the ground? And is there indeed a health crisis in this space?
Thank you very much, Mr. Nameni, for the question, and good afternoon to the listeners once again. Before I get into it, I just want to give a small apology. I tend to be under the weather, so you may hear me cough once in a while or clearing my throat. Please do excuse me for that.
That's completely fine.
In terms of, all right, thank you very much. In terms of identifying whether this is, or whether we should rather call this a crisis, I think we're past what we would term crisis, and that we are basically falling within the scope of what we would term this as a catastrophe, a complete catastrophe, taking into consideration that it is every Namibian's constitutional right to have access to health. You did underscore, or you did indicate that our committee went onto the ground sometime last year and we visited the region. And we have uncovered a couple of things such as dilapidated infrastructure, the lack of medication, lack of the smallest things such as health passports. And I would really say at this point in time, maybe we could, for lack of a better explanation, we're in the catch-22 situation. I really don't think that the matter of urgency is being addressed as it should be. And I can give you an example of the current issue that we would want to term as decentralization. And I think it's basically the underscore or basically the foundation of the majority of the problems that we find ourselves in. Everything at this point in time in terms of functionality remains at the central government store. And I can give you an example. In Rundu, we have a medical store that was in need of an aircon. And an aircon is one of the requirements or set standards for us to make sure that the medication does not go bad. They had to find a way to write or rather to receive authorization from the head office, which is based in Windhoek, which then holds everything in stagnation because nothing is moving. You have to wait for Windhoek to respond, and only God knows how long that actually takes and how many people are in the office in Windhoek. It also goes beyond the budget. The operation within the ministry itself is of high concern. I don't know whether this could be a result of them being overwhelmed or maybe being understaffed. But my point of departure at this point in time is that the methods remain in the stress, and the ministry needs to start being innovative. We need to start looking into areas such as perhaps getting into MOUs with the VCC to assist, the renovations of minor areas within the infrastructure, or perhaps getting into MOUs with other stakeholders that will be able to assist. And I feel that's also an aspect that is missing from the ministry. So the question of urgency is something that I don't think is being addressed at this point in time. I don't think we understand, and I think we undermine the outcry from the public.
Junius, I'll bring you in here quickly because last year when Honorable Muteka said, listen, it seems that we do have a health crisis in our hand. We then brought in the Ministry of Health on this platform and asked that to the accounting officer, which is Ben Nangobe, and asked him, is an actual health crisis? He said, look, I do acknowledge that there are many problems in the health system in this country. We are managing them and they are manageable. But to say there's a health crisis, we're stretching right now. Unpack that for us.
Yeah, I fully support the sentiment of Honorable Muteka and the issue of agency, and for the ministry to acknowledge the seriousness of the crisis, which is because if the government is saying there is no crisis and we are seeing that people are suffering on the ground, nurses are demotivated, there are no medications in hospitals, we are seeing dilapidated infrastructure. So it's a big challenge because you expect the person who was entrusted with the responsibility to deliver, but the same person, when he's informed that there is a crisis and he needs to act with agency, the same person is saying there's nothing like that, there's no crisis, we are overrating the issues. So it's a big challenge, and that is why I'm off. I have some doubts that these guys are still going to relax and take the crisis as it is. And because they have normalized this crisis and they don't care. I always I like giving example since independence that this government has never built a referral hospital, so we still have a patient being referred from Katima to Vindu just to seek basic health care, and we still have hospitals that are still they were busy with a hospital in Chivarongo, which was everyone expected to become the center in this the referral center for those regions which are very far from Windhoek. But that hospital since 2015 is still is just the fence. And even in the budget of Mr. Shimi, there is nothing speaking about that hospital. So we are sitting with ignorant people who are playing with people's life, who are undermining the rights of Namibians.
But to say that the ministry is not serious is a bit of a stretch, isn't it? I mean, in this particular vote for the health and social services sector, they, like we mentioned, receiving 10 point, well, it says here 10.9, and that's sum of 34.3 billion over the medium term. Within that allocation, they've availed more than 450 million in the development budget, including commencing the earthworks at the Windhoek District Hospital in Havana, the expansion of primary care centers and clinics countrywide, and improving the capacity of referral hospital services. They are doing something, aren't they?
You see, Honorable Muteka mentioned about something about decentralization. So to say, to put an emphasis about the Windhoek District Hospital, I really have some reservation about that. But he says we have to comment because Windhoek is also growing. But look at the region, the way people are suffering.
They do say
in the
here clinics countrywide also.
But they are talking about the renovation. They are not talking about building new clinic or building new referral hospital. If you read that statements again, so that is the challenge that we are sitting with now. So we can't have a government that cannot even show us any district hospital that they have built from scratch. You are not serious. And we are still have medical doctors who are sitting at home. We still have nurses who are unemployed. We are still have other cadres who were supposed to help and to be on the ground to save this healthcare system.
Honorable Muteka, I'll bring you in here because you also carefully looked at the state of equipment or the lack thereof when you visited the regions last year. There's been a further consideration here in the budget that has made to cater for the recruitment of medical personnel. You spoke about the issue of staff as well as the acquisition of pharmaceuticals and medical equipment. I'll just ask you to bring that context into the conversation, and then we'll quickly chat about that because they also made a report of what they have had to procure since the previous financial year. But you may.
All right. So basically, when we talk about, or when we would want to outline the employment of medical personnel, at this point in time, if we were to do a shopping list, I personally would think that this would be something that we need to prioritize. However, we need to take into consideration that when we focus on employing the medical personnel, it also comes with its challenges. At this point in time, as the other speaker has also indicated, that we have doctors and nurses that are sitting at home that are not being employed. It could be because there are certain challenges that are not being addressed. Challenges such as you get a nurse who has no problem whatsoever to go and probably work within a remote area. However, that place has got no accommodation. And I can give you an example throughout our oversight. We've picked up to say that a lot of people are struggling to have their basic needs met. And this is the challenge that people would find themselves, they really, really want to go and work. They would not mind, applying for the position or whatever the case may be. But then the question comes in to say, how am I going to be taken care of? The other issue is also the pharmaceuticals. I just mentioned earlier the issue or the challenge of aircon, because it is a standard requirement for you to have your pharmaceuticals in a cool area. So if you're telling me that a store doesn't have an aircon, or it could possibly physically be there, but it's just not working and it can't be maintained or it can't be fixed because an authorization needs to be obtained from the central point of view, from the central part of it being in Windhoek, then what exactly are we saying?
Are we perhaps...
The question would then be to say, have we done proper monitoring and evaluation? Have we identified what the problem is?
And I want you to continue on that, Honorable, because I'm just thinking to myself now, if we perhaps aren't putting too much pressure on the Ministry of Health and while demanding that they do everything at once, seeing that they are only one entity. They themselves argue that, look, since the last financial year, there have been about 170 infant incubators sourced, 50 phototherapy and infant warmers, 28 dialysis machines. I mean, look, the list can go on. Nine X-ray machines as well. So there is sort of a movement happening of some sort. Whether that's slow or not is another debate. But can't we give them some sort of grace for at the very least trying to procure some of these goods that are, or equipments rather, that are dire within our health system?
Without even thinking twice, Mr. Namene, the Ministry of Health will definitely, I'll give them props. The credit must be given where it's due, and I can give you an example of a beautiful structure that was built deep in the Sibinda constituency in Zambezi region that, caters for basically majority of the needs of that community. However, I just feel that there are still certain areas that are of priority that we need to address as a matter of urgency. And at this point in time, the shopping list is quite large. The shopping list is quite long. And it's a challenge on their end to say, how are we going to go about it? How will we actually be able to make sure that we deliver services? So we're not saying that the Ministry of Health is not doing anything. And we're not saying that the Ministry of Health must be put under heat. We give props and we give credit where it's due. We also give credit to areas such as we've been hearing reports of medical personnel not necessarily behaving themselves ethically and that they have improved. We have to give props. We need to give credit where it's due. However, the shopping list still remains long, and it's a concern. And this probably puts us in a position to say we are in a crisis. We really are.
Indeed, and I want to use that word that you use right now, which is the issue of prioritization. Mr. Shilunga, I'll take it to you. With this particular budget, with the current state that we find ourselves in right now, where should the priority be? Because, look, like I mentioned earlier, it's probably difficult for the ministry to do everything at once. You, of course, have your constituents, which is the nurses, right? Being from the nurses union. But if you have to look at it from an objective point of view, where should the ministry prioritize its budget first and why?
Yeah, no, good question. So we know there's a crisis, and the crisis needs to be addressed. We don't have enough health facility in the country. That's why I was giving a practical example about Kashmir.
So that's number one on your list.
Yes, they must complete Ochivarongo State Hospital, the referral hospital. There's a fence. They have the land. The money now is allocated. They must complete the hospital so that we can be able also to recruit those nurses, those doctors who are unemployed. So they must also make sure that we have enough medical equipment, we have enough medicine in our stores. It can't be right that we still send our old people to buy by themselves hypertensive medication, diabetes medications. It is not right, comrades. So we are saying the government must put their priority in order, and they must not just prioritize themselves. And in fact, the Ministry of Health is the most, it is the ministry that receive a huge chunk from donor funding. If you look compared to other ministry, because most of the project in Ministry of Health, they are funded by the donors. So the money is there and it's enough to say they can be able to address those issues. The problem is ignorance. And when you are ignorant to the plight of the citizen on the ground, then that is why we are getting that situation of a crisis in the Ministry of Health. We need to save our people. We need to make sure that our people are safe and they are getting the best health care. Look, if you did management, there's what we call, even at workplace, the motivation of workers. How do you motivate your workers? How do you want your workers to perform to the best of their abilities? If you go in the hospital, I always tell journalists to visit. You are allowed to visit the hospital. Check the working condition of those nurses, where they are seated in very confined rooms where there is no even aircon or ventilation. You expect that person not to get frustrated.
I want us to. I'm glad you brought that point up because Honorable Muteka also pointed that out. There's this issue of personnel and attitudes. I mean, we've had this problem for the longest time in Namibia, where citizens complain that when they go to a hospital, nurses or doctors themselves just purely have a bad attitude, and surely one hand washes the other, right? So are you attributing the state of facilities, the state of working conditions to a poor attitude?
Absolutely. That's why I'm saying for you to get motivated, these nurses and doctors, they took an oath to save life. But there are instances where these patients, these 3 patients of mine, they are sick and I understand their illness. And for them to be cured, I just need this ABC medication. Then you go to the pharmacy, these medications are not there. Then you think these are human beings. Deep down, you are thinking that I'm sending this poor person to go by. And this person cannot afford in some instances. So that thing will ring into your mind. And that will demoralize you. To say we are trying to do so much to utilize our knowledge, but the government of the day is letting us down. The nurses are working even more hours, overtime hours. They are being told you can't claim, you cannot be compensated for all those hours. But they did not work those hours because they want to. It's because of the demand and the need that is on the table. So it's really something that the ministry or the government need to take serious, because we have been getting these issues of public servants not performing, but public servants are performing in a harsh condition. And those bosses, what they do is just to punish. They don't even check what is going on the ground. They just want to punish. Okay, you did this wrong. They don't want even to listen to you. They want to punish. But you tried, sometimes you sacrifice. Sometimes nurses are even taking money from their pockets to buy even the medication for the patients.
Honorable Muteka, I'll come to you now, and we'll go back to that issue of priorities. I'll also ask you about the status of your report right now as a committee, but just from what you have gathered, the evidence you've gathered last year, Mr. Shilunga here is saying that look, we need more infrastructure. We need to get those hospitals and those reference hospitals, the clinics out in the regions as soon as possible. Where does your priority list stand?
All right. I think at this point in time, my number one priority would definitely be the availability of medication, as Mr. Shilunga has alluded earlier, even if it means for us to operate from a temporary building perhaps or structure, just to make sure that our people have access to medication. And we're focusing on the medication that can handle any sort of temperature or environment per se. And then the second one for me would definitely be, without second guessing, the availability of ambulances. You'll be very surprised that one region only has one ambulance available. And you get vast regions, for example, such as Zambezi. It's a very, very vast region, and you would get somebody who is about 200 kilometers away. We had an incident where one of the nurses were narrating to say we had a lady who was an expectant mother, and she started getting into labor. And by the time the ambulance had arrived, she had already delivered the baby, and the baby was a couple of hours old already by the time they got there. So I think for me, definitely medication, ambulances, and the recruitment of key personnel. But most importantly, for us to take into consideration, and when I say consideration, I'm not only talking about saying it, but finding a way to intentionally decentralize some of these functions when it comes to the Ministry of Health.
And I just want to remind the listeners and the viewers at this point that we did try to do everything within our power to bring the Ministry of Health and Social Services onto this platform to come debate this particular issue. It does seem that the minister and his executive director are not in the country. The deputy minister is occupied at this moment, so we struggle to get them onto this platform to come debate their side. But perhaps just to get back to you, Honorable Muteka, there have also been a lot of eyes being put onto your committee and to Parliament at large on holding the executive accountable. There's this constant conversation that, yes, the committees go out and they go do reports, but when it comes to drafting those reports and putting those recommendations into Parliament and then having those debated, it takes quite a while. There's a whole bureaucratic process around that. What is the status of the report from the visits that you conducted last year?
Excellent. Perhaps I could first start off by giving you a consolidated overview of how far we've went with the oversight from our committee. So we managed to finish, or we rather rounded up only 10 regions out of 14, of which the report is ready and prepared. The procedure is that once you are done with your oversight, you're expected to table a report within 30 days after concluding your oversight, depending on what the circumstances are. And by circumstances, I mean, if you concluded your oversight a month or during a time before you find yourself in session, obviously there's nothing you can do to meet the deadline of 30 days. However, the moment you do get back into session, you are then required to table the report. The report will then further be discussed in the House with the recommendations thereof, and the House then decides whether they are going to adopt this report. Once it's adopted, the procedure is that we load it on to our website. So anybody that would want to get hold of that report is more than welcome to get onto the website of Parliament, National Council specifically, and you look for our committee. It is uploaded. In terms of holding the various ministries or OMAs accountable, one would want to say at this point in time, with the 10 regions that I'm referring to that we have concluded, we are yet to sit down and have a consultation or have a session with the minister himself, because what we request is, for a lack of a better word, we summon the minister himself with his personnel, and we will sit down and we will lay everything down on the table to say, look, this is what we have found, and we've compared A, B, C, and D. We've also looked into the MTEF. This is what you had promised the people was going to happen. It hasn't transpired. Can you please have a response thereof? Or what is the situation? Where are we at this point in time? After we receive the report back from the minister, or from the ministry rather, we then have to send out this report to the regions that we have visited as a means of feedback, to give them feedback to say, look, we did A, B, C, and these are the steps that we have taken, and this is what the minister or the ministry thereof has indicated in terms of responding. However, it goes further than that. There are certain instances where we would then sit down and say, look, we want a response on a particular issue, or rather feedback within 30 days to say, you haven't done this, you promised you're going to do it, and in 30 days we're going to come back and say, we want to know how far you are, what is the progress? And we also make sure that we publicize this feedback, and we also give it back to the specific concerned community.
Mr. Shilungo, I'll bring you in here, and perhaps just to respond on what Honorable Muteka had to say. Look, there are definitely many processes and systems that have to take place before these recommendations go to Parliament and they are debated there. Yes, maybe some steps are valid in that you have to tick many boxes through this process, but somebody like you who's on the ground and represents, workers who are directly affected, is there too much bureaucracy happening within systems and processes at Parliament level, at executive level, that make it difficult for you to make sure that your nurses are in a good condition?
Absolutely, yes. The issues of bureaucracy and processes, Parliament here, the ministry here, to me, it's not really important, because we all understand the crisis, and and even just to take you back, we had the presidential inquiry during President Pohamba's time. I think there was a report about the crisis within the Ministry of Health again. But since then, we didn't see any progress. So for us who are on the ground, we can assume that this is the modus operandi of the government. But all we want is progress, and we want those issues to be addressed. Those processes are by the way. We can't wait for the process to be finalized while we have a crisis here. I always tell people that when you are sick, the illness, you can't put illness on hold to wait for the processes to be finalized. The illness will continue to eat you up until you are dead. But these processes will take even 5 years. But all we want is the government to understand and to acknowledge that there is a crisis and to address the issues as they were presented to them, whether formally or informally, and to make sure that our people are safe, to make sure that our nurses, our medical personnel are working with proper equipment. Nowadays, we are even moving towards technology. But by the look of things, Namibia, we are very behind. So we want Namibia to embrace technology. We want to make sure that government fast track the process of deliveries of equipment and medications in the hospitals. The renovation must take place. So for processes, that's bureaucracy. It has been there, and we know is done by politicians. Sometimes we don't even trust politicians. But one thing again, we have a failing minister with his team, but we are still keeping such people. I don't know why, because you can't keep an incompetent person in such a critical ministry. You are going to kill people. And when the health sector is going down, you don't have a country, because young people are going to start getting sick. Then the generation of young people is going to be wiped out. Old people are getting sick. That generation. Now you don't have a country. Health is the backbone of a country.
I'll come back to that. Unfortunately, the minister and his ministry isn't here to rebuttal on that. Honorable Muteka, at the risk of perhaps repeating yourself, maybe we just didn't get that. With the processes and systems that you explained right now, perhaps just in a nutshell, to allow the listeners to understand, as well as the viewers to understand on a timeline on when we can expect all these systems and processes to be checked, and when we can expect this report to go to Parliament, debated, recommendations set, and then, of course, hopefully implemented. What does that look like in terms of a time frame?
All right. So the set standard is 30 to 60 days, and this is when we would want, or we expect to have feedback from the said ministry or the minister pertaining on the questions or the inquiries that we may lay on the table.
And when are you going to do that?
We will be doing this in April, as of April, because you must also understand that we are not in session the whole year. We are probably in session 3 to 4 times in a year, depending on which month we find ourselves in session. And this is something that I also sometimes want people to really understand, to know that there's a difference between those of us who are members of parliament at National Council and members of parliament, members of National Assembly. Those of us who sit in National Council are first regional councillors, which basically means we are down in our region on the level of constituency. So we are scattered around the country, and we don't find ourselves in the capital city, such as our colleagues of the first house, the National Assembly. So it heavily depends on the time that we find ourselves being able to be in session when it comes to tabling the report and having the discussions thereof, because we can't proceed with the inquiries without the reports being adopted by the House, because we'd need to discuss it. We'd need to hear the views of the different colleagues or the colleagues from different regions, obviously representing their regions, to say, yes, indeed, this is the situation, or no, probably you didn't capture it well, or maybe you missed a step here, or you missed a spot here. And then after it's adapted, then only can you take the step of doing the consultations with the said ministry or minister.
So we're looking at sitting down with the minister around May, June, somewhere there.
We're hoping.
Mr. Shilunga, we are getting towards the end of our conversation now. We were here a few months ago, you all remember, with Honorable Ephraim Nekongo speaking on this exact same issue. The budget has since been put down on the table. You're not quite impressed with the figure, but perhaps just in closing, have you seen a difference in action at all from the ministry since that time you were here, and you, as you repeated yourself now, called the ministry incompetent? Have you seen a difference or plan in motion, actions from the ministry, and maybe double that up with what you expect moving forward?
In fact, now it's worse. It's becoming worse. Yeah, I thought they will improve. These guys are not serious. And that's why we are saying the government or maybe the head of state needs to look into this thing, into this crisis, because there is no agency, there is no accountability. It's just a mess. These people, they are not willing to do anything. And so I expected, after they were exposed nicely during that parliamentary committee, when they were visiting regions, I thought they would fast track the processes. Now it's becoming worse. So by the look of the budget, as I said earlier, that the government must always prioritize health in the country. So it can be correct that we signed a declaration of 15% of a country's budget, but we are giving a mere 10%. So it means we are not serious, and the government need to be serious, and to also give us competent people in the Ministry of Health. Ministry of Health is not Ministry of Sports. We can live without sport facilities, but we can't live without hospitals. We can't live without medication in hospital. We can't live with nurses sitting at home and doctors. It's a crisis. How can a small country like Namibia, have doctors who are unemployed? It's a very shameful situation. And I think it's a high time that a politician in particular, especially those ones who are in parliament and national council, put people in confidence to say, let's fight this crisis and let's prioritize the Ministry of Health. Make sure that our people are safe, our people are healthy, so that we will have a productive country.
Honorable Teka, your closing thoughts, and perhaps just to emphasize, you're under pressure now. Namibians are looking at you and your committee, holding you accountable, putting you under pressure to, well, table that report as soon as possible, see what recommendations come out of there as well, see if anything actionable comes out of there. Perhaps just between now and the tabling of your report, the budget has been set. What are your expectations moving forward?
Most definitely the engagement between our committee and that of the minister and the personnel from the Ministry of Health. And you're totally right to say that the pressure is on our committee, and we can feel it. We have sleepless nights as leaders, because at the end of the day, your wish is not necessarily that you can physically control. One can just hope that you follow the processes and the systems properly, and that something actually does come out of it. But there's something that I also just wanted to outline that was said by Mr. Shilunga there. Sometimes it's not necessarily the accountability from the minister or the deputy minister or that of the ED. Sometimes it could be the colleagues that are in positions such as the directors of these various regions. Sometimes it could be unfortunately, I'm not really familiar with their titles per se, but it's the people on the ground, the people that are responsible for the smallest of functions that we need to start looking into and understanding whether these people are really competent. I can give you an example. There's been this thing of, or this tradition of us constantly blaming the Procurement Act or the procurement process. But there are certain provisions set out in the Procurement Act that give you what we can term a plan B if plan A doesn't work. But our colleagues are just not proactive. And that's where you get to ask yourself questions to say, what exactly are we saying? What exactly are we dealing with? Perhaps it's just also the proactiveness of our ED, perhaps, or the various colleagues that have to now move more out of their offices and start engaging on the ground. If, for example, they're responsible for a specific region and I'm a director there, can we appear in a specific hospital in that specific region without announcing my arrival? Just to make sure that the report that you've submitted to me is actually in conjunction with what is on the ground, what the realistic picture of it is. I think these are steps that we need to start taking, and we need to start holding people accountable. It sounds very nice when you think about accountability, but the question is, to what extent are we actually putting it into practice?
Well, I guess we'll wait and see on how things do pan out. As mentioned, Honorable Muteka, your committee's report is being waited for with bated breath by Namibians, as well as from your side, Mrs. Shilunga, with the Nurses Union, to see what steps, suggestions, recommendations can also be made moving forward. As mentioned, the one hand washes the other, but the consensus that we do have on this particular panel is that there is a health crisis in the country right now. A 10.9 billion Namibian dollar budget has been set for the Ministry of Health and Social Services and the health system in the country generally moving forward for the 2024-2025 financial year. Will that fix all the problems we have? Will that fill the gaps that we have uncovered within this system? I guess we'll just wait and see. For your time this particular afternoon, Honorable Muteka, as well as yourself, Mr. Shilunga, I do thank you so much for making some time for us. This has been the conversation. For everyone who is tuned in on our Facebook platform, listen to us on Desert Radio throughout our frequencies, as well as on our streaming platform and on DSTV and GoTV. I thank you so much. From myself, John Colin Amin, and everyone else in studio, cheers.